Pharmacy Talk. I'll just give you just a few minutes to introduce yourselves.
Hi, my name is Bobby Sidhu. I'm a contractor in Berkshire and also work as a surgery pharmacist.
Hi, my name is Mohammed. I'm a pharmacist, independent prescriber. I work in the GP surgery and I've been in that role for the last 4 years.
Great, so it's good to have you two on the show.
Thank you.
I know this is a big topic about pharmacists working in GP practices, but the reality is there are some pharmacists like myself, I work in the community, and the question is, can we work together? So if you just tell me a bit about what you do, about your roles, and then we could discuss if you could have a GP pharmacist and a community pharmacist working together.
Strangely enough, I'm passionate about community pharmacy. I think it's got a vital role in the community workplace, in a town, in a village, and it's how we marry the two roles up. Now, I know there's some sort of elitism about being a practice pharmacist knows much more is much more clinically orientated than a community pharmacist, and actually that's not the case. What they've got to do is work together. They've got to be symbiotic, and the GPs have to see that we're actually one and the same thing.
Yes, in my role as a practice pharmacist at a GP surgery, I see patients with complex conditions within a community pharmacy setting. I don't get to use my knowledge of drugs to help patients. In a GP practice setting, I'm able to get access to patients' full medical record. I'm able to see their blood pressure results. I'm able to see their cholesterol level, their full blood count, their U&E, liver function, their HbA1c. I've got a whole host of information that the community pharmacist lacks. And that gives me a better opportunity to make use of my skills.
It's interesting you bringing that up, actually, because I think what we're talking about is two different roles. So I'm not saying they're one and the same thing. What I'm saying is that the same pharmacist can perform both roles. And one is not a better role than the other. What happens in a GP surgery is diagnosis is made. GP has 10 minutes, if they're lucky, to discuss the future, the next sort of months, 2 months, 6 months of their treatment, their care plan, etc. And obviously they can't achieve that in that period. So what happens is, at that point, the patient goes to community pharmacy, who then follows up the service, follows up with diet advice, healthcare advice, self-care advice, how to take the medication, how the medication is meant to be looked after, and often explaining what the GP actually did in the consultation, because often they're pretty blinded and shocked by what's actually happened. Suddenly I've been diagnosed diabetic. I'm still recovering from, am I a diabetic? I don't want to be a diabetic. And that's where the community pharmacist comes in, and with that clinical role as well. Wow. You can achieve so much because they're working together. And I go into surgery and say, "Oh, do you know something? You've just given this drug. There could be a risk of hyperkalemia. Oh, can I just have a quick look at the blood test?" So that's what I actually do. And to be honest, do I do more as a surgery pharmacist, a community pharmacist? I'm not sure. Because community pharmacy, they're saying, "Oh, can I speak to you all the time?" In a surgery pharmacist, it's potluck who they speak to. So where am I achieving more? I don't know. It's symbiotic. And what's interesting, my colleague here actually points to working in a surgery, but actually he works in community pharmacy as well. And I've seen some really good stuff that he's done while he's in community pharmacy, getting out the BNF, querying the dose, following up what he believes on, checking tinzaparin, the dose, the administration, how to administer it, both equal sides. So what I don't want to do is paint one more than the other, because there's a lot of community pharmacists that feel really down about, "Oh God, this guy's working GP surgery, he must know it all, I don't know anything, I'm not good enough." No, rubbish. We were there 2 years ago, 1 year ago. We've done the IP course, we've learnt as we've gone along, we've spoken to a friendly GP colleague and actually got going. And then with our peers and talking to each other, we've sort of helped ourselves along. And in a way, I'm thankful to Mohammed here, or I call him Irfan, but because I was an IP before him, I became very concentrated on my contractor role, started another pharmacy up and actually got so focused on that, nearly forgot my IP. While he started working in a surgery, and I thought, well, actually, am I falling behind? Do I need to sort of get going? So he sort of said, you should do it. I've now followed up with it, and I actually see it from both sides. And I think one cannot work without the other.
That's quite interesting, because personally I work in a GP surgery, so I'm as a community pharmacist but co-located in a GP surgery. And what happens, I'm the main pharmacist.
Yeah.
And so they come to see me, and I feel I enjoy the role because I'm the person they come to.
Yeah.
Now, they might get a pharmacist in the future to work with them, and it's not clear for pharmacists like myself to know what's going to happen when these pharmacists come in. So what you're saying is quite interesting today, because it's really looking at ways that we can still work together, And I think many pharmacists out there the community pharmacists don't really know what's going to happen when you bring in a GP surgery pharmacist, when you've already had that community pharmacist, had that relationship with them in the first place. So I think talks like this will be very interesting to reassure us that we can actually work positively together.
Oh, absolutely. GP practice pharmacists know exactly what it's like to be a community pharmacist. Most of them do a dual role, or at least in the past have done that role in a community setting. So moving from one sector to another sector just gives them that extra background of each other's roles. So it's certainly a role for both of them to play. The only thing I would fear is sometimes community pharmacists don't have those 10 minutes. You mentioned the GP practice pharmacist would have those 10 minutes solely in a room one-to-one, but in a pharmacy setting, community pharmacy setting, you're probably looking at 5 minutes maximum, and that's with possible distractions in the background, probably not in a closed setting either.
Could I answer that actually? It's interesting you mentioned that, and I think it's a good valid point. However, with medicine use reviews, new medicine service, I find often I've given 5 or 6 of those sessions to a patient, or 5, 10, 15 minutes when I've been in the room longer than expected, and then followed up with a new medicine service. What does need to happen, however, is the IT suppliers need to link up the data. There's no point me collating lots of information about new medicine service in written format. It needs to go into the PMR system direct. And I've explored a couple of solutions with, I won't mention the groups, but other people saying we're bringing it in, we're bringing an online platform to do that. But the one thing I want to happen is actually all that data to go into the patient PMR. So when I tap the patient's name, suddenly it will say NMS, and what was the NMS? What did I do? What actually action points did I action? And to be quite honest, we follow up regularly. So actually, I don't think we have 5 minutes. We're on the room for 10 minutes, 15 minutes sometimes. It depends on the complexity of the situation. And it's a follow-up. We can follow up at any point. On a GP, I think one thing our pharmacist colleagues don't realise is actually how inundated our GP colleagues are right now. And I think being in a surgery, there's a lot of paperwork. They get through a lot of workload, and I'll be honest, we can only take a little bit off them for that.
Wait, so to round this up, what do you think about the future of pharmacy? What are your thoughts about the future of pharmacy?
The future pharmacy is changing. The current dispensing model cannot continue. I think door-to-door distribution will occur. Community contractors will become less. There'll be more pharmacists in general practice, and possibly the end of community pharmacy in the next 50 years.
50 years. Wow, that's a long prediction, isn't it? I agree with most of what Mohammed said there. I think it is getting automated. However, people value face-to-face communication. Even sometimes a screen is not good enough. They want to be touched, hugged, whatever. They want that relationship. And I think that relationship is what a lot of people are still crying for. And as we get older, we know that dementia is coming, Parkinson. They really need that touch. And otherwise what you'll have is ghost towns with ill people walking around with no solutions to their problems other than automation. And it doesn't mean that pharmacy's dead. I think pharmacy's got a whole new model to explore now. And I was talking about pharmacy being dead, or hearing about pharmacy being dead 20 years ago. And I'm hearing it again now, and we'll hear it again in 20 years again. And what Amazon's doing, yes, it's going to automate dispensing, but I think we've got a really valuable role to play.
Brilliant. So here on Pharmacy Talk, one of our goals is to unite pharmacy through conversations like we're having today. So it's really good to have you guys, and we can sit here and discuss different things, pharmacists from different areas, because what we notice is that although we're all pharmacists, it still feels like we're different, because the community pharmacist is different from the hospital pharmacist. We want to have platforms, one shared platform that we can all sit down together and we can discuss. What do you think about the idea?
I think it's a great idea, right? I think you need also pharmacists and CCGs actually communicating with local pharmacy, community pharmacies, and not a sort of top-down role, actually getting stuck into the communities. And I think that's what patients value. They want the face. They don't want a name or somebody at the end of a phone. They want to be able to go and see somebody. And I think, yes, bring it on.
Fantastic. I think this is a great platform, bringing the pharmacists from different sectors together. So more may continue.
You guys have been excellent. I look forward to working with you in the future. Thank you very much.